will try to be brief. Um, I think so. The question is about motivating the clinicians, right, to accept and trust the AI systems. Um, I think Summer mentioned earlier about sort of like the reinventing the wheel aspect, and I think that definitely in a way holds true. So one of the thoughts I had in mind was it's not new, and there's quite a lot of research around that, and that I was thinking of participatory design. There are some interesting case studies which have shown that especially actually in the case of AI, there's a couple of examples I think for training Watson, for example, how involving the professionals early on in the process of designing the technology is actually helping. One, it's helping design a technology that really works for them, that is really attuned to their requirements, to what they want to do. But two, sort of in valuing their expertise and making them feel involved. So I think it's also in a way behavioral tactic as well. And three, in helping sort of build the trust, because obviously there is a learning process in the AI, and it needs time to improve, so that if they can see this learning process themselves, they can be, I think, better convinced. And then again, I think we're gonna see sort of like new kinds of specialties and roles emerging, which I think is quite interesting. I know, for example, not for clinicians, but for nurses, there's actually interesting programs where nurses go and develop data science skills themselves. And there's case studies that have shown that then those kinds of roles are actually quite important for the successful implementation of maybe not necessarily sophisticated AI tools, but I've seen it for developing evidence-based methods for sure in healthcare settings. I think it's a challenge there, obviously, because clinicians are already overloaded with work. I don't know how they could just take time off and go develop. So that's there's the pragmatic aspects of, obviously providing them with additional training. But I think it is necessary, right? At least to the extent to which they can understand what AI is about and what it does, to be able to trust it, even if it's hard, and even if it requires investment, personal investment, as well as organizational investment. I think it's absolutely necessary. We cannot expect them to just interact with the tool, especially when they are accountable for the decisions at the end of the day, and just use the insights, right? And I mean, I already talked earlier about crossing knowledge boundaries, but it's absolutely necessary. We need to have translators, potentially those kinds of like new kinds of blended specialties that we may see. Those could play out the role, I think, of boundary spanners who might be able to translate between the different domains of expertise. And the last thing, which I don't know how new it sounds, probably not that new, but obviously there's lots of talk about explainability of AI, and I think that's absolutely necessary here. We need to have explainable insights produced. I am in touch with a really interesting person who is she's set up her own startup on developing AI for healthcare, but she's also a member of EU's sort of like explainability experts kind of group. And what they do in part of the tools that they develop, they are one tool that they develop specifically is on sort of supporting clinicians to choose the drug that is most likely to be effective for a specific patient. So the idea is sort of like more tailored kind of drug recommendation. And for that, they try to make sure that at least on a basic level, there is the insights are accompanied by some explanation about what kind of indications led to the recommendation of the specific tool. There's different levels of explainability, and obviously it's hard to go too deep, I think, even for the computer scientists, but designing for explainable AI will definitely be important, I think, especially in the context of healthcare, where the accountability is very important. And I wanted to sort of just give one last comment, which is not necessarily a response to how we can make them accepted, but in the interaction I had with clinicians was I realized that we have a different perception of objectivity and bias, because to them, having insights that may come from AI, which even if they accept, I think they trust that they are objective, they consider this as an additional source of bias, because they feel like, well, if I know that this is the likelihood of this patient surviving, for example, then I start developing a different approach towards that patient, and I may not want to have that information because I may put less effort to try and save the patient if I think that, well, the chances are very limited, for example. So I think that's something interesting to consider as well. It's not just about trusting the insights, but it's also about thinking of what I do with that, and thinking if they want to know it, to know those insights, assuming that they trust that it is reliable. So